Well, I'm Alan Dale from Gale Force Winds. What an absolute pleasure it is to be here. Beautiful Nanaimo, British Columbia, talking to the good people at Discovery Community College. I like talking to people that are truly making a difference. And on that note, why don't you introduce yourself? Tell us what you do.
My name's Shai McNulty. I've been a nurse for the last 7 years. I graduated from this school in 2019. I started in 2017. And immediately after graduation, I got a job before I graduated.
Before you graduated?
Yep, at the place I did my preceptorship. It was an amazing place. I worked in long-term care for a couple of years, and then my family dynamic moved us out to Cobble Hill.
Mm-hmm.
And there I started working in the hospital, which was always my dream. So
Wow.
I worked in the hospital for about 6 months before going on maternity leave.
What was your pathway to become a nurse? Did you always want to be a nurse? Like, what were you
I
doing?
didn't even know what a nurse was.
Talk to me about that.
I remember in 2000, I think it was 2012, I drove by Sprott Shaw Community College and saw that they were intaking healthcare assistants. And I didn't really know what a healthcare assistant was. At the time, I was a community support worker with no education, just internal training where I was working. And I wanted to expand my career. I didn't want to be there forever. And so I was like, I wonder what an HCA is. I talked to my partner, and he said, well, why don't you go in and ask? The next day I went in and asked, and I ended up signing up for the program. Once we finished that program, in 2013 I graduated, and I knew that that's not where I didn't want to stop there.
Right.
I was doing all the care aid tasks, and I remember seeing the nurse behind the nursing station and being like, I want to do that.
All right.
It took me a bit to get there because of family dynamic things that were going on, but I eventually found this program online, and also from the previous instructors at Sprott Shaw said, you know, we don't offer it here, we used to, but Discovery Community College is set up very similar to Sprott Shaw, and they offer the LPN program. And so that's when I looked this up and then came and talked to, I believe his name was Brian. 2 days later, I was in the LPN program. And
What was your experience like at Discovery?
It was great. It was really great.
Yeah.
We had really supportive teachers. My 3 instructors that were with us the whole time, Arlia, Carolyn, and Mona, were super supportive. It almost felt like, instead of super large classrooms with not enough attention, you got a lot of attention in these classes. If you needed help, it was there. If you had questions, they were answered. It's kind of like going from a larger classroom where it's hard to be seen and heard to a smaller classroom where it's easier to be seen and heard, which I feel like benefited my career in the long run.
So during your sort of practicum, you got a job and started working. Talk to me about the journey in nursing then. Where did that take you?
So I remember when we went onto our practicums, I went into long-term care. I also remember our clinicals in the hospital as well, and really loving that. But at the time, I knew that where I was at in life, that was a lot. It was a really fast-paced environment, and the skills they have there are so high. And due to my own self-confidence things, I just wanted to be comfortable somewhere for a while before going into something so serious, working in a hospital.
Right.
Long-term care is also very serious, but hospital nursing is a different ballgame than long-term care.
Yeah. So now you're a nurse, you're obviously passionate about what you do.
Very.
But nursing found its way into your life in a different way recently.
Yes.
Tell me about that.
So when I went on maternity leave from the hospital, we gave birth to a healthy baby boy. And 2 days later, he developed a volvulus malrotation in his intestines and went to septic shock and had to have emergency life-saving surgery. They removed about 97%, and he was left with 8 centimeters of intestines, leaving us to do TPN care, PICC care, liver failure maintenance, and everything associated with it at home. And had I not graduated from nursing school prior, I think that would have been a really big challenge for me to do, and it also helped me advocate for him throughout his whole entire life and his medical journey, There were times that I saw things that didn't fit, and I was able to advocate for that, and then look up published articles and things like that, and be able to provide them with evidence-based information so they could include it in their assessments and things like that. So it made it, my nursing career really helped me.
It was almost
boost
meant
up.
to be, right?
Yeah, it was. It really
Yeah.
was. And I don't think I could have done it without that.
Right. Transplant happened? Talk to me
Yes,
about
yes.
that.
So he ended up receiving a multi-organ transplant because of the complications from short bowel syndrome. It's a really rare diagnosis, and there's something called TPN-associated liver failure, and not everybody gets it, but our son ended up getting it. So basically, for him to stay alive, he needed the TPN so he didn't failure to thrive, malnutrition, and pass
Right.
away. Although the TPN was toxic to his liver. So it was kind of choosing between two of the worst.
Right.
And the TPN eventually damaged his liver and all the septic shock episodes to the point that he ended up in end-stage liver failure, and he needed 4 organs to maintain life. He received the short bowel, large bowel, small bowel, large bowel, pancreas, and liver. The liver was necessary, and so was the small bowel, but the other ones were just put in there for maintenance, just because it's easier to put in a whole block than make a bunch of cuts.
Wow.
And it was kind of cool being a nurse on this side of things because I was able to understand a lot of things they were talking about. And a lot of other medically complex parents and patients I've talked to have told me, you know, you're really lucky to be a nurse in this because you understand the other side of things that some of us don't, and it helps you advocate a lot harder and be seen when you're doing it. I notice a lot of these families struggle with that without this background.
Aside from the incredible emotional toll that must have taken on you, although I have to comment how remarkably composed you are, you must have had a lens into the healthcare system and looking at this stuff through the perspective of a nurse to see so many opportunities for nurses. You must have seen nurses doing things in there that you never even thought were in the possible.
Yes.
Talk to me about that.
So after this experience, I disassociated myself a lot as Cohen's mom just because of the emotional aspect of it. I knew that if I was putting my emotion into it, it would affect his care, and I wouldn't be able to advocate as properly as I could.
What you went through as a mom and as a nurse,
The lens, yes.
you from the lens of a nurse, you must have seen incredible opportunities for nurses, right?
When I talk about the disassociation, it made me think about every other nurse in the world and how this would affect their career and how, you know, I remember in clinical being excited to see these operating room signs and things like that. And then next thing you know, I'm living under those operating room signs and transplant degenerative medicine signs. And it was a lot. And it was hard to see sometimes, but I felt like if I have this opportunity to experience this and I can share it to help other nurses change their perspective of healthcare and patients and families, then I think that that's the meaning of this whole entire story, Cohen's story, his survival. And so I started doing presentations, and for people that work in healthcare as well as medically complex parents, this is how you advocate for your kids. This is how you advocate as a nurse. This is how you become a collaborative team with your patients and their families to get the best outcome possible for your patients. And I started sharing our story to get people to see that perspective. And yesterday was the first time I presented it formally in front of a large group of people versus a smaller group, and it went very well. I actually did it here at Discovery, and it was emotional, but it was really received by the students. I feel like it was an impactful message, and I didn't realize how impactful it would be. Because of course, when you're living it, you don't realize the impact of the situation you're going through. So we were like, you know, if we could share our story to change people that work in healthcare and help them see this perspective before they go on clinicals, so they're aware. Because, you know, we're taught this stuff in nursing school, but when you're working in the field, sometimes it's easy to forget some of the things, especially when, you know, as a nurse, the the dynamic can be different sometimes, and you just really got to be aware of your own values and things like that. So I just wanted to take it and turn it into a teaching moment versus dwell on it. And, some people take these things and it affects them drastically, mentally, emotionally, physically. It did with us too, but I wanted to channel it into something positive. So.
The scope of practice for nurses has grown so much over time,
Yeah.
right? And you would have seen it from the time you graduated, but you would have really seen it when you got involved in the very complex situation that you were. Talk to me about if you were talking to somebody now that wanted to be a nurse, what would you tell them about being a nurse?
Oh, I was thinking about this last night. I didn't mention it yesterday when I was talking to the students, but I was like, wow, medical complexity is so broad. And when you think about medical complexity, you think of an RN, a doctor, someone dealing with an unstable patient. Medical complexity could be congestive heart failure, type 1 diabetes. It could be a neurological mental illness issue. We are going to come across medical complexity in every scope of healthcare that we're working in, whether you're carried, an LPN, an RN, a doctor, a nurse practitioner. You're going to come across all of these complex issues. And so to be aware of them is just something to almost benefit yourself.
What do you think it takes to be a good nurse?
That's a hard question to answer, but also very easy. And I feel like to be a good nurse, it takes somebody that's aware of their own situations and is able to step back and look at things from an outside lens. It's really easy to get caught up in judgments, emotions, and all those things when you're in nursing, and to shut down. Like I was thinking on my way here that, nurses will go into a room and give patients news or do a treatment that, is they're going palliative, or you've just sat with a family while their loved one took their last breath, and then you have to go into the next room and pretend like that didn't happen. And it's really, really hard to do. So as a nurse, the thing that I think makes the best nurses is to constantly reality check yourself before you're in a situation, while you're in it, and after a situation. It's okay to reflect before, after, and during. And if you reflect on your own self while you're doing your care, it can help that person receive the care that they truly need, and also make it feel like you have compassion towards them. It's the worst when you're a patient in healthcare and the response you get from somebody from a question you've asked or a statement you've made is defeating. And I understand as a nurse myself that can happen in work. And so I didn't take it personally. I understood it because I've been there. But at the end of the day, some people haven't. And if you can do that as a nurse, I think that would make you the best one. As well as, keeping your critical thinking skills sharp. Question everything, to an appropriate level. And don't be scared.
What's the future look like for you guys?
So I didn't know if I was ever going to return to nursing after my son was born. It was quite traumatic, obviously. And then after thinking about all these things and how it could, change healthcare, and I said, I feel like it might be a little bit of a disservice if I left nursing altogether. I don't think I should leave. I think that our story is super powerful coming from the parent and nursing perspective. I feel like the story might lose power if I wasn't a nurse anymore. And this story is so impactful that it can change people's, career in a sense of not having to experience that traumatic experience that shapes your nursing. Because when we were in nursing school, we were told, at some point in your career, you're gonna face a really traumatic experience that's gonna shape you, and it's gonna shape your career, and it's gonna change you. Unfortunately and fortunately, I didn't get to that point in my career. I had to deal with it with my child instead.
Right.
So being able to share our story to other nurses and things like that helped. So I'm actually returning to work, hopefully this year. Okay. I hope to be back by May. I need a little bit of time just to process everything that happened the last year. But I'm definitely going to be going back. I've contemplated going back for my RN. I've contemplated applying to jobs to teach nurses versus working in the hospital. I don't know where this is going to take me in my career, but it's not going to end my career.
Right. I have a feeling it's going to be good wherever you go. How's your son?
He's great. He's doing very well. They said he's one of the best recoveries they've seen. He got an amazing donor match. We think about his donor family obviously all the time. It's hard to talk about because we know obviously what happened for him to be here. But he's doing great. He's living a normal life. It's nice to see him chunky and running around versus, you know, very, very skinny and very, very sick and yellow. It also is so cool to see, you know, my career where I work was part of this miracle, even though we were directly involved, even though it wasn't my nursing and I wasn't employed there, just being like, wow, this is our job. This is what we get to do every day. And this is what we get to see and be a part of, was just such an aha moment for me to realize that, you know, life is so precious.
Thank you for sharing that story with us, and thank you for doing what you do, and I'm so happy things are on the trajectory towards success for your son and for you. So thank you.
Thank you.